Maharashtra continues to reel under the COVID pandemic. More than 9,000 cases have been recorded in the last 24 hours, with Mumbai reporting over 1,000 cases in a single day once again. Now, Maharashtra is currently one of the worst COVID-affected states right now. The state constitutes almost 48% of the active cases in the country. The current surge is similar to the spike as we saw in October last year, but the central team that was sent to Maharashtra said that it was possible that the COVID virus could be less virulent now, even though the cases are rising. Now, we're now analyze the COVID data, comparing the numbers between October last year and now. While the number of cases are similar as in October 2020, the death count is significantly lower, as is the number of patients requiring intensive care or even hospitalization. Data also indicated that most of the new cases are asymptomatic. Those are the latest details coming in as far as the COVID situation in Maharashtra is concerned. So if you look at various counts at this point in time, we're talking about the current death count, which is 90% less than what it was in October 2020. Nearly 50% of the ventilator and ICU beds are vacant now. And this is, of course, an indication that many of the new cases are asymptomatic. Let me go across to Disha, who's joining us for more details. Disha, if you can break up the numbers for us, what does it look like? How does the cases now compare to what we saw in October 2020? And also specifically, the central team has also talked about the fact that this could be because the virus has become less infectious or less virulent.
Well, certainly, Avni, there's a lot of talk and there's a lot of questions that's being raised at what exactly is happening in the state of Maharashtra in terms of COVID cases, because the trend and the speed of the graph of the cases that we are looking at is similar to what we have seen in October last year. But when the center recently had come and they had visited several areas, they have made some important observations and based on that observations, we on the ground level have done certain analysis talking about the same period, about October last year and currently March 2021. So as per the center, the intensity of the virus has declined a bit, what we saw in October. So as far as the infection, although it is spreading across and we are looking at the similar sort of cases, but the rate of the infection is not that deadly what we saw in October. And this, of course, the numbers really point it out. If you talk about the occupancy of beds, in October last year, Avni, the hospital admissions were more. People required more ICU beds and ventilator beds for that matter, which showed the seriousness of the virus at that stage. So if you talk about the data particularly, only 11% ICU beds were vacant in October, and today if you talk about, more than 50% of the beds are vacant. If you talk about ventilator beds, only 9% ventilator beds were vacant in October last year, and today if you particularly talk about, over 46% beds are available. And if you talk about oxygen beds, Avni, at that point in time, only roughly about 9% beds were available. And today, if we talk about, 74% beds are vacant. So this, of course, shows and establishes the fact that the virus is less virulent, and that is what even the center team has established. Second most important point, the deaths. In October, the Maharashtra state had reported on an average daily 300 to 400 deaths. But today, if we talk about, there is at least 90% drop in the death count, and which is only about 36 to 40 deaths that the state is reporting. So this establishes the fact that although we are looking at the infection spreading, but it is not that serious, it is not that deadly, the intensity has gone down.
Right.
But definitely we should not lower our guard is what the government authorities say.
Yes, absolutely, Disha. That's extremely important to underscore here, that lowering our guards at this point is something that just should not be done. Thank you so much for getting us all of those details. Let's get a little more perspective. Dr. Narendra Gupta, Public Health Advisor, is joining me on the phone line. Dr. Gupta, these comparison of numbers on detailed analyzing of the October numbers versus now in terms of the death rate, in terms of, the kind of beds availability now versus then. Do you believe that that this perhaps could be the fact that we are seeing more of asymptomatic cases now, and the virus perhaps could be less infectious compared to what it was back then?
It's always possible, though, in whole of South Asia, not only India but other neighboring countries, the virus seemed to have been less virulent and that's the reason we have witnessed much lesser case fatality in comparison to Europe and Americas.
Right.
So that is there, and these new variants which we have found out in India seem to be less virulent, and that's the reason that we are not getting so. There are cases which are we find are positive, but at the same time they are not symptomatic, or they are not getting severely ill, or there are more deaths.
Right.
So it's certainly seem to be the case, and as the time passes, I'm sure the virulence will start to decline further. So, but it doesn't mean that we should lower our guards, and we should still keep all the precautions essential for its transmission.
Yes, absolutely, Dr. Gupta. The other question I had here is that considering the fact that, yes, it could be that the virus is less virulent now and we might be seeing a high number of asymptomatic cases, how does that, pan out in terms of getting a handle on the spread of cases that we are seeing in Maharashtra at this point in time? Because more asymptomatic cases would mean that the only way to gauge whether you have COVID or not is by getting a test. So it would be that much more important to increase the testing now.
Yeah, it's essential that the more and more people are tested, so that you begin to know about the pockets where there are infections, so that you can sort of create some kind of a area which is means you take more precautions on those areas, and if need be, restrictions could be imposed on those areas so that the infection doesn't spread. And by doing this, we are sure then we can control the overall transmission in a much more comprehensive manner, and that is what is required essentially. So testing is needed certainly, and that testing should be done on the basis of the contacts. If we find somebody positive, then other contacts of that person should also be tested, and if we find reasonable number of people positive there, then we need to take more precautions in terms of quarantining and in terms of imposing restrictions.
All right, Dr. Gupta, thank you so much for joining us with all of that perspective.